Representative Bonner, would you like to move House File 4576 to the General Register?
Yes, Mr. Chair, I would move that House File 4576 be referred to the General Register.
Okay. All right. Representative Bonner moves House File 4576 be referred to the General Register. Would you like to describe your bill, Representative Bonner?
Yes, thank you, Mr. Chair and members. I want to start, of course, with a little bit of thanks and gratitude. This bill has been an extensive amount of work in work with my colleagues over in the Senate, authors Kiffmeyer and Hayden, and has garnered support from Senators Cohen, Rosen, and Senator Gazelka, and of course on the House side with the support of my colleagues like Representative Freiberg and Joachim. This bill came about as a collaboration between the Public Employees Retirement Association, the Minnesota State Retirement System, the Legislative Commission on Pensions and Retirement, which is a bipartisan, bicameral body tasked with overseeing pension funds and regulation, the Office of the County Attorney, the Governor and his staff, as well as numerous nurses behind the scenes. As you know, healthcare organizations began to ramp up in preparation for the pandemic, and the issue of staffing rose immediately to the top. We know that other states have had staffing challenges that have become an issue as employees fall ill or those who remain on the front lines have been asked up to step up and do more to fill those gaps. In doing so, these frontline workers put their own health and their families at greater risk. However, here in Minnesota, as you know, we are very fortunate to have a deep bench of exceptional healthcare professionals, doctors, nurses, and other badly needed healthcare staff that are operating today on what are called phased out or post-retirement agreements. In other words, we have a wealth of semi-retired and retired individuals that can fill in these gaps, and in fact, many do today in our healthcare system. We also have a wealth of recently retired licensed staff that can be called upon in this crisis. These experienced professionals are already equipped with the extraordinary skills and expertise which are uniquely needed to fill in staffing gaps due to illness or provide necessary backup for those frontline folks in the pandemic. These workers have vast knowledge in areas like emergency care, urgent care, triage, intensive care unit experience, and they're already familiar with staff and internal operating procedures for our healthcare organizations. To be concise, they can step up with little or no training in a crisis situation. These are extraordinary folks that can be tapped to aid staffing efforts. Folks like my mom, a veteran of 44 years at HCMC, and her colleagues, folks like Sandra, Pam, and Mary Jo. These men and women have served at the bedside of our loved ones, providing critical care, comfort, guidance, and compassion for some of those folks in their most challenging times for both families and patients. PARA, with the support of MSRS, brought forward a letter to the governor requesting authority to change certain provisions in the retirement plan requirements that prevent employees and employers from fully mobilizing these badly needed and very talented reinforcements. At Hennepin Healthcare, for example, a Trauma One facility, which we know will be disproportionately impacted due to the nature of the population that they serve. There are currently about 40 employees augmenting staff that would encounter this issue, with more raising by the day potentially as this pandemic continues. The statute under normal guidelines limits the number of hours these seasoned employees can work and still maintain their pension eligibility and payments. That said, as hospitals reach out to other retirees and gather additional reinforcements that are willing and able to face this crisis, we want to eliminate any deterrent to these everyday heroes that they may encounter in answering this critical call to service for Minnesota's citizens. This request specifically modifies Minnesota State Statute sections 353.371, which limits the hours that PARA or MSRIS retirees may work under existing phased out or post-retirement option agreements. And the bill asks that the limitation be suspended for all retirees who work in the healthcare or healthcare related positions until such time as Executive Order 20-01 can be rescinded. It is important to assure that anyone coming out of retirement to help during this crisis can feel confident that their financial well-being will not be impacted by penalties to their pension while they step up to care for our loved ones in our time of need. And with that, I do actually have a testifier here today. And I do also have, you should have received a letter of support from Hennepin Healthcare, as well as a letter from Becca Lundberg, who is a certified nurse anesthetist as well, who is directly impacted by this bill. And with that, I do have Doug Anderson from PARA here today to testify in support of the bill.
Welcome to the committee, Mr. Anderson. Please identify yourself for the record and then proceed with your testimony.
Thank you and good morning, Chair Freiberg and committee members. I'm Doug Anderson, Executive Director for the Public Employees Retirement Association. PARA is supportive of House File 4576. I also did speak with Aaron Leonard, the Executive Director of the Minnesota State Retirement System, who asked me to voice that they are also supportive. We do recognize the urgent need for healthcare workers as a result of COVID-19 and believe that this bill helps respond to that need. The bill has no adverse impact on PARA. It does allow for additional hours for these workers. However, they would not be making contributions to the plan during that time, nor would they be accruing any more benefits. So it has no impact on either money coming in or money coming out of PARA. It wouldn't have any change there at all. There's also really minimal operational costs. This is a very small group of members, so really no issue there. We do appreciate working with Representative Bonner on this issue and Hennepin Healthcare and the LCPR staff to help craft some language that helped address some of our pretty minor questions. And we do believe that the bill as drafted is very helpful and addresses an important need at this time. So with that, thank you for hearing my testimony. I'd be happy to answer any questions.
Thank you, Mr. Anderson. I believe I heard Ms. Lencheski is here in case there are questions, but you don't need to testify. Is that correct?
That's correct. Thank you, Chair Freiberg.
Yep, thank you. Oops, sorry about that. Representative Nelson, you are first on the list for member questions.
Well, the mute here. I was just going to say that I support this bill as a member of the Pension Commission, but also I'm and our pension plan has a similar model to this, that we allow retirees to work a certain hour raise that limit so that we can man the job sites and it allows retirees to gain some extra money. So this is a good common sense solution to the problem we have right now with the COVID crisis. So I fully support this amendment, this bill.
Thank you, Representative Nelson. You are, in fact, the only member I have on the list. I thought there might be more conversation about these bills this morning. I'm going to just wait a minute just to make sure there's nobody else who wants to speak to this. Okay, seeing none. Representative Bonner, do you have any closing remarks?
I should have mentioned that there is no fiscal cost associated for the state with this bill. And I want to, of course, thank again the folks at PARA, Hennepin Health, HCMC, MSRS, the governor's office, as well as all of those nurses who really helped craft this bill. And of course, Susan Lencheski, who was critical in this effort from the LCPR. Thank you so much for your help with this. And I think this is a much needed bill that will do some real good. So thank you for your support.
Thank you, Representative Bonner. With that, I will ask the clerk, Ms. Somick, to take the roll. And Representative Bonner, I guess, renews her motion that House File 4576 be referred to the General Register. I will ask that the clerk take the roll on the bill.
Representative Freiberg,
Yes.
Representative Salk,
Yes.
Representative Quam,
Yes.
Representative Bonner,
Yes.
Representative Elkins,
Yes.
Representative Gomez,
Aye.
Representative Heinrich, Representative Kegel,
Yes.
Representative Lehman, Representative Lehman, Representative Lee,
Aye.
Representative Lilly,
Yes.
Representative Mason,
She needs to unmute herself.
Aye.
Okay. Representative Nash, Representative Nelson,
Yes.
Representative Tice,
Yes.
Representative Vogel,
Yes.
Representative West,
Yes.
15 ayes.
Sure. Should we see Representative Lehman? I think you might have been muted as well. Are you? Representative Lehman, are you still there?
Representative Lehman,
We tried. So there being 15 ayes, the motion is agreed to and the bill is on its way.